Let's talk about something that keeps a lot of us up at night: access to healthcare, especially as we get older. If you're over 50, you probably know what I mean. Getting an appointment with your GP can feel like winning the lottery. And when you finally get in, you might be told you need a referral. Then it's weeks, sometimes months before you hear back. It's not just about seeing a doctor either. Home care, social care, maybe you're caring for a partner, or you're worried about who'll help you stay independent if you ever need it. The system feels stretched. Staff shortages, long waiting lists, confusing processes can make you feel like you're on your own. But here's the thing, there are solutions. Telehealth is a game changer. Video calls with your doctor, online prescription renewals. Remote monitoring can save time and get you help faster. Some communities are bringing care closer to home, mobile clinics, more support for home visits. And don't underestimate the power of speaking up. If you're struggling, let your GP know. Ask about local support groups. Ask about advocacy services. Sometimes just knowing what's available can make a huge difference. We need to keep pushing for change. Better funding, smarter use of technology, more support for carers. It's not about asking for special treatment. It's about making sure everyone gets the care they deserve when they need it. So if you're feeling anxious about healthcare, you're not alone. There are challenges, but there's hope too. Let's keep the conversation going and look out for each other.